Health Education England supports the delivery of excellent healthcare and health improvement to our patients by ensuring that our workforce has the right numbers, skills, values and behaviours at the right time and place. In the North West, the Workforce Transformation Team funds initiatives that develop a responsive workforce by developing future supply, upskilling staff, carers and volunteers, and developing and promoting new roles and ways of working. This video is one in a series of case studies exploring innovative and transformational ways of working to share and promote entrepreneurial workforce development across the system.
A physician associate, I would describe it as it's a new healthcare role in the NHS, primarily working alongside doctors and nurses. So we study a postgraduate qualification. It's a 2-year course. We do 4 months of intensive study, and then we cover a range of placements in the first year. And then in second year we do sort of more placement based, and then we take a national exam at the end to qualify. We're revalidated every 6 years by a national exam, and we sort of have to maintain our generalist knowledge across medicine.
A physician associate is a new type of clinician introduced into the UK. Their role includes the ability to diagnose, interpret data, and also come up with management plans. So yeah, good scope of abilities there. I did think about medicine, but I think the PA is a good role for people coming from allied or other health profession backgrounds, such as myself, and patient contact is what I wanted from the word go, and I think this physician associate role is perfect.
I mean, City Health Centre is a new practice, so we work in a different way. We're a 8 to 8 practice. We're open every day of the week. We have a walk-in centre alongside the general practice. We have a young population and our health needs are completely different. One of the problems we face is there's not a need for your traditional practice nurse where you have chronic disease, because we just don't have that. So what you need is somebody that can also do sexual health, somebody who can also see patients and help out with the workload. The PA role comes in ideally for that, because it's somebody that you can take on who has got a generic skill set that you can then train to be the person that you want.
I think I've been very lucky actually to be placed in GP first, and I've been able to build on my consultation skills, my history taking skills. So with my supervisor, I work shadowing him, learning consultation skills. And if the patient presents a disease that I've potentially never come across or my knowledge isn't that great on, I will go away, and he's really supportive of that. I can go away and learn about that and develop my knowledge on that.
During my placement at the practice here, I got to understand the current roles that are here, the advanced nurse practitioners, the midwives, understanding their roles, what skill sets they bring. And then what we did was sit in with my mentor, observing and shadowing consultations, and then as I was competent, felt more confident with the demographics of the patients and the types of patients that we saw in this practice. I saw my own patients under supervision to take histories and carry out investigations and formulate management plans.
12 months ago I'd never heard of what a PA was. So I think coming in here I was slightly apprehensive as to how we would be received, but everyone from the admin staff up to the GPs have been really positive and really supportive and curious about the role, asked lots of questions, and the patients as well have been really receptive, really interested in the role itself and how we will work in the NHS when we qualify.
When I first started the PA programme, I wasn't sure where I was going to end up, but towards the end of it I was pretty sure that general practice was the place for me. For me personally, it was about not just seeing someone for the first time, but getting to see them again and again and building that rapport with them, getting to know their families and really helping them, not at just one time in their life, but throughout their time whenever they needed to seek medical attention.
That's the main thing that they've got from being here. They come in and they're used to, or their expectations of what they'll see are based around what they know of A&E and other things, but general practice is completely different. You come in and patients just can talk about literally anything, and I think even though that's something that they first find challenging, I think what they've learned are the skills that you need to deal with situations like that, the communication skills and the consultation skills. General practice can offer those in bucket loads.